Yeah, yeah. So let's just bucket our conversation. If we're concerned about the lower back, then we're going to be the joint by joint begins its power by looking at the joint systems above and below.
Hmm.
So we'll talk about the thoracic spine, the lumbar spine, and the hips. The hips will include the iliosacral joints, etc. But we're you can see this isn't like a diagnostic model. This is just a concept of how to think.
Yeah.
One thing that I would like to make clear is actually two things. Number one, the joint by joint theory, this way of thinking, this will not help us in perhaps changing low back pain per se.
Yeah.
What it will do is help us understand how we got there
Yeah.
and maybe how this thought process may help us. This may not be the only way to solve back pain. It
Yeah.
could, but this is not a using these approaches may be very useful in the remodeling of a current system that is painful, but it is more of a way to think and more importantly how we got there rather than how we fix it.
Yeah.
Okay? Because this is really only a biomechanical model. This is a
Hmm.
very physics based, engineering based model.
Hmm.
When pain is in the system, biomechanics don't lie, but they don't always tell the whole story anymore. But
Sure.
this but before we were in pain, it was our biomechanics that brought us to this place.
Hmm.
The other thing too is that pain is a very interesting thing where just because we have bad biomechanics, are they bad? Are they inefficient? Well, how are we judging this? Well, indeed, we see with repetitive exhibition of non-ideal biomechanics, we see pain and injury. So we know this.
Hmm.
However, we also see different variations of intensities of these inefficient biomechanics, and people don't have pain. Okay, so pain is a completely individual thing. It's based on perceptions, and it's basically based on our brain recognizing that something is not right. This is a threat perception. Uh, Two people can have backs that have been ravaged by inefficient joint by joint principles. One will be in pain, and the other one will have no pain.
Hmm.
So we should be also be very clear on what pain is, and inefficient joint by joint does not always equal pain. It's not positive, but doesn't always equal pain.
Yeah.
Okay. So when we look at the from breaking into this model, the stable segments, when they move without control, we regularly see injury.
Yeah.
Okay, so that this much we can say. So what type of injuries do we see in the lumbar spine that are from these inefficient mechanics in our fitness or in our movement? Well, I think we can look at things in a couple different ways. Obviously, the lumbar discs, the intervertebral discs, are quite powerful pain generators. The brain will recognize this as threats when the annulus has injury, when the nucleus has pushed through the annulus, perhaps now impacting nerves, etc. Many, many different things. But how does this happen? Well, ultimately, if we do not have control of the lumbar spine into any direction, flexion, rotation, or even extension in some cases, then the body, the brain may recognize this as a threat and then start to elicit a painful response. So if our lack of control in the lumbar spine is creating some kind of disc pathology, the brain may recognize this as a threat. Okay. The other thing, if we have a decreased control in the lumbar spine, is the actual joints of the spine of the lumbar vertebrae themselves. And just like any joint, they can become arthritic, they can become subluxated, they can be. I'm not familiar with a dislocated lumbar spine. The nature of the joints make this very very challenging. But I guess in theory, in a terrible car accident, this could happen.
Hmm.
And again, these are all pieces to the puzzle that whether it's the joint or the disc, then these threat perceptions there can abound. There's nerves that can be impinged. We can have stenosis of the canals in which the nerves travel through that go down our legs. So if we do not have control of the lumbar spine into efficient movement patterns, then we can start to have threat perception in the lumbar spine. Okay. Now we
Okay.
have two ways in which this can happen via the joint by joint. Perhaps I do have adequate mobility of my T-spine, and I do have adequate mobility of my hips.
Mm-hmm.
Well, now I simply don't have the motor control to properly execute my movements that I'm asking of myself, or so my trainer or coach is asking me in my fitness or sport.
Mm-hmm.
So I'm probably successful at doing what I think I'm trying to do. However, my spine is not under the ideal control.
Sure.
The joint by joint really wants us to know that if I'm trying to perform, let's say, a squat, and my hips do not have the mobility to get into flexion,
Mm-hmm.
which I require to squat, what will happen is I will likely squat to the same depth that I'm being coached, or that's what my volition is to get to.
Mm-hmm.
But because I don't have the mobility in my hips, I will then give up the mobility. I will give up the stability in the lumbar spine. I'll start to flex in my lumbar spine to make up for my hips. I'll still get down to reach the object that I'm looking to pick up,
Mm-hmm.
but now that lack of control in the lumbar spine, the inefficient position, is likely setting me up for some kind of injury or threat perception. So we will rob mobility, we will rob stability rather to pay for mobility.
Right. So it's kind of as if as a very sort of loose angle of looking at it, if we're experiencing some degree of pain in the back, there could be some correlation with regards to how much movement can happen at the thoracic part of the spine and in the hips.
Exactly.
Would that be sort of
Yeah,
fair to say?
exactly. If we don't have, for the movements we're choosing, if we don't have efficient mobility in the T-spine or hips, we're going to make up for that lack of mobility by moving through the spine, the lower back too much. And moving in the lower back too much can beget these injuries. So the first thing that we need to start to do before we're in pain, let's make sure the T-spine and the hips are moving to a standard of mobility.
Yeah. Cool.
And then we move on to training the lumbar spine to have great control.
Yeah.
We certainly, if the system is already in pain, we can take the model that Stuart McGill champions in terms of sparing the spine,
Mm-hmm.
meaning we'll keep it in this, what we know is this ideal position, and then we demand hips and T-spine to move so that the lumbar spine doesn't have to. It's just the nature of the joints and the discs and there's no disc in the hip, but there is discs in the T-spine. They are not as prone to injury
Mm-hmm.
when they move a lot.
Yeah.
This is the joint by joint. So when we look at our mobile joints, when they move a lot, people don't get hurt there. Okay? When they don't move, that's when the degenerative changes happen at the hips and the T-spine. So this is where the joint by joint can be involved with the low back and back pain.